Today on UMTV News, new information shows the coronavirus could have been in the United States since February.
The virus was probably introduced and circulating in our community again far earlier than we had known.
Plus, some rapid coronavirus tests have been giving false negatives. And in one Florida district, parents are showing some undesirable behaviors when it comes to their children's school grab-and-go meals. These stories and a lot more ahead. UMTV News starts right now.
Hello everyone and welcome back to another quarantine edition of UMTV News. I'm Katie Benty. This fall, experts say there will be a second wave of the coronavirus. Until then, there are still a number of questions they're trying to answer. How much resistance will it have? And what parts of the country will have more widespread cases than others? The answers may come from researchers who say the virus might have been spreading right under our noses long before we knew it.
Patricia Dowd had been in good health. The 57-year-old had a nutritious diet, according to her brother, and took no medications. Rick Cabello told CNN she was an athlete in her high school days. She was always active. Tonight, she's believed to be the first coronavirus-related fatality in the United States. We previously thought the first COVID-19 death had occurred in Kirkland, Washington, on the last day of February. But we know now, based on a posthumous test, that it killed Patricia Dowd in Santa Clara County, California, more than 3 weeks earlier.
That indicates that the virus was probably introduced and circulating in our community again far earlier than we had known.
There is indeed jarring new information tonight on how early coronavirus may have struck inside the United States and how many cases there could have been, what amounts to a hidden explosion of the virus right under America's nose. A new model from researchers at Northeastern University shared with the New York Times says that on March 1st, when New York City confirmed its first case, and there were only about 24 confirmed cases in 5 major American cities, there could actually have been some 28,000 cases in those cities at the same time.
We call this the cryptic stage of an epidemic. Is that moment in time in which we have the transmission of the disease from individual to individual, but we don't know yet. So what we have is that the epidemic spreads silently until it reaches a critical mass, and at that point we start to see the tip of the iceberg.
At the time of Patricia Dowd's death in February, the virus was thought to be mostly concentrated in Wuhan, China, where it originated. That is what President Trump said about the virus just 4 days after Dowd passed away.
But I think it's going to work out good. We only have 11 cases, and they're all getting better.
Not long after that, U.S. officials thought coronavirus cases were bottled up on cruise ships, thought that scanning incoming travelers could keep the virus out of the U.S., and the CDC said to only test people who had been to China or who had been in contact with somebody who had. One expert says the new model from Northeastern points to disastrous early responses to the virus by U.S. officials and an opportunity lost.
This whole testing issue has been mismanaged from the very beginning, and if we weren't identifying these cases, they were going basically out into the community, able to spread this virus to other individuals, and then we ended up in the situation that we're in today, using very blunt tools like mass shutdowns and extreme social distancing. It didn't have to be this way.
In addition to helping us understand how to plan for the resurgence of the coronavirus in fall, experts say the new model can also help hospitals plan for how many ICU beds and ventilators they may need. Experts are also saying new information has been released on the rapid coronavirus tests, showing that there's a 15% chance of a false negative.
Abbott Laboratories is issuing new guidance for providers using its rapid test to prevent this from happening. The problem lies in viral transport media, which is used to store swabs until they can be tested. Pathologists at Cleveland Clinic found the problem. Of the positive swabs, the test only detected the virus in about 85% of those when stored first. Abbott is now telling clinicians to insert swabs directly into a testing machine without storing them in transport media first. The tests had been used for about 2 weeks before the problem was uncovered. Experts say that it is to be detected when new tests are rolled out quickly in an emergency situation. They warn other problems could arise in the future.
Problems are also arising in a Florida school district. A superintendent is calling them undesirable behaviors. People took too much advantage of the district's free grab-and-go meal program. The behaviors include parents trying to get a second round and trying to sell the meals online. This after several sites ran out of meals last week.
A free food frenzy. Parents accused of going back for seconds and then selling the meals. These screenshots show the food handouts being sold on social media. We're also told at least 47 cars were turned away from last week's meal pickup because they already had school food in the car.
We had some individuals that made undesired behaviors last week, but we stand ready with new organizational controls. Hats off to the operations and IT department for helping us with this process.
Now staff will be using a meal tracker. That means parents must provide their child's name and student ID number to make sure parents don't cheat the system and kids don't go hungry.
To make certain that children in need actually get the nutrition that they need to be successful during the e-learning process.
For kids too young to go to school or who don't attend Tampa schools, parents will have to provide their name and birth date to get meals. That's it for this quarantine edition of UMTV News. Remember to stay inside, stay safe, and stay hopeful. We will get through this. Have a good night.